We've also presented some data using oral decitabine or decitabine cedazuridine in patients with MDS and MDS-MPN overlap syndromes. So we've had about 40 patients treated with decitabine cedazuridine, and I'll use DEC-C as an abbreviation for it. Decitabine has been used for patients with lower risk MDS in a 3-day IV regimen. However, oral decitabine in a 3-day regimen hasn't really been looked at in the real world setting. So in our 40 patients, about half of those patients have been treated with 3-day decitabine, and then the other half received the FDA-approved dose of 5-day decitabine. The majority, 90% of those patients treated with a 3-day regimen had lower risk MDS per IPSS, so either low or intermediate 1 risk, and the majority of patients treated with the 5-day regimen either had a higher blast percent, more than 5% blast, or a higher risk disease to begin with. What's interesting is in our cohort of patients, similar number of patients had higher risk disease per IPSS-M, and we actually noticed that the survival, there was a trend towards a shorter survival duration for patients receiving 3-day regimen versus 5-day regimen, and we believe that the fact that a similar number of patients having higher risk per IPSS-M may have accounted for those differences. So I think for studies using the original IPSS to include patients to treat them with 3-day regimen, we need to be cautious and probably validate the IPSS-M in those studies to ensure that we're not undertreating some of those patients that may need a 5-day regimen.